All right, we know that Thanksgiving's a time for gathering with family and friends. It is certainly a time to be grateful, humble, and thankful as well. And we are joined by our medical expert, Dr. David Winter, for his thoughts on this holiday time of year, because you want to be healthy too, right, Dr. Winter? It's trickier around Thanksgiving.
Indeed, you do want to be very healthy. In fact, that's one of my wishes, is to have good health for everyone. You know, in my business, I see people with good health and bad health. Fortunately, with modern science, we can take care of people a lot better than we used to. But still, doctors like to cure. I like to cure people also. When we can't, though, comforting, compassion, helping those, that's also a job that we do, and I'm thankful for that opportunity also, Mark.
Well, I'm always thankful to get a chance to chat with you, Dr. Winter, as we are getting ready for a big day when we know that family will be getting together. When you talk about wanting to keep folks healthy, keep away some of the bugs that we know we can get when we gather around, what message do you have for patients and our audience in regards to good health and staying healthy this time of year especially?
You know, actually, some people are just lucky. They have bad habits and get away with it at least for a while. But I'm convinced good health habits can decrease the chance of illness, even prolong our lives. What I'm talking about here is adequate sleep, good sleep, trying to minimize, avoid, cope with stress when you can, exercise regularly, avoid bad habits like tobacco, excessive alcohol consumption, of course, illicit drugs, and then food. Food's very important. Good health eating habits are also important, Mark.
Well, let's talk about those good eating habits, because I know for a lot of us, they're going to go out the window this weekend. But if you are, trying to be your best self on maybe other days than Thanksgiving, what would you recommend that we consider when it comes to good eating habits?
Yeah, good eating habits is lots of fruits and vegetables, whole grains, moderate use of dairy products, maybe olive oil instead of butter. You want fish and poultry instead of red meat at least some of the time, and then less sweets, desserts, sugary beverages. That's going to be the hard part the next couple of days, Mark.
Friday. Start that on Friday is what I tell people. Let's talk about, we've covered certainly the weight loss drugs, Ozempic, the semaglutides, quite a bit here on Daybreak. When it comes to folks who are using those kinds of medications, any additional considerations they may have when you've got holidays like these where there's going to be a lot of food and a lot of sweets, as we mentioned?
Yeah, a new concern has just come out, Mark. So what those drugs do, they call it GLP-1 agonists. You mentioned Mounjaro, Ozempic, Zepbound, Wegovy. What they do is they lower your hunger hormone, but they also slow the movement of food through your intestines. And a couple reports of people that have splurged on those medications and had bowel obstructions. So splurging with those drugs is a problem. For the rest of us, so Mark, occasional splurge I think is okay. Just don't do it all of the time. And be thankful in this country, we have plenty of food. In fact, be thankful in this country for a lot of other reasons also. So good health habits in the long run, but in the meantime, have a good weekend. Happy Thanksgiving to everyone, and try not to splurge too much.
Too much. Good advice as always, Dr. Winter. I'm thankful for your advice this Thanksgiving especially.